The NHS is warning of a tripledemic this winter, with flu, COVID and rising emergency cases. Figures out this morning show 344 patients a day were admitted to hospital with flu last week. This is 10 times the number seen in the first week of December 2021. 19 in 20 adult, general and acute beds were occupied over the last week, with overall occupancy levels at 95%. And more than 13,000 beds a day were occupied by people who no longer needed one. This is up a quarter compared to the first week of December last year. Well, let's get more on that story from our health correspondent, Ashish Joshi. And that last figure, Ashish, really just shows the root of the problem. There are so many people in these beds that they can't get new people in to treat them.
The urgency in social care is impacting the entire NHS, and that's been the case for some time now. And that's recognised, I think, now by the government. It's announced as fund to help NHS trusts and their social care partners to be able to move some of these patients out, free up the hospital beds to try and ease the pressure on the NHS as it grapples with what is turning out to be a very difficult winter. Some of the other figures that you just read through there, that tells us flu season is already here. The number of patients in hospitals with flu extremely high, and we've only just begun the start of flu season. So this is the tripledemic that NHS leaders and health leaders have been warning about for some time. We have COVID, it's still around and it's still impacting hospitals and healthcare. We have the flu season underway. We also have this incredible pressure on emergency departments, and now we have the spectre of union action over the next few weeks. We'll hear tomorrow from the nurses about the dates when they announce what dates they'll be taking industrial action. That will impact elective care, routine appointments. They'll be pushed back. So this pressure that continues to build on the NHS is certainly beginning to tell. And especially with flu, the problem here is there's an acute shortage of paediatric intensive care unit beds. Flu impacts mostly on children, especially vulnerable children with underlying health conditions, and the elderly. I've been speaking to paediatric consultants over the past couple of days, and they've been telling me about a real shortage of beds and some of these children having to wait in emergency departments before they can access their intensive care beds. So flu, I think a lot of people are quite dismissive about it, or have been, because we haven't seen it over the last couple of years because of the pandemic, because of mitigation measures, because the viruses haven't really been spreading around because of social distancing as well. But now it's back, and we were expecting respiratory illnesses to rebound, and they certainly are. This is what the Chief Operating Officer for the Imperial Healthcare Trust, Claire Hook, had to say about the pressures on her trust over the winter.
Our activity, I think, this year is about 7% up in terms of the number of patients who are coming through our accident and emergency departments. But we're still at quite an early stage of our sort of winter season, so we would expect to get much busier as the course of the next few weeks go on, and we are expecting it to be particularly challenging, partly because of the backlog of our elective work that we're getting through, and partly because of the demand at the front door, as well, of course, as the potential around respiratory illness, COVID, flu, etc. So we're planning for a very, very busy winter.
So we knew these pressures existed already, but it seems now, looking at the latest data, this winter situation report, which is the first time this winter it's been published, it'll be published every week on a Thursday from now on. That will give us a real indicator about just how much pressure the NHS is coming under.
Ashish, thank you very much.